We are now going to see the minimum indicators in DRTB program monitoring. There are 4 sets of indicators that are important for DRTB program monitoring: case detection, enrollment on treatment, interim outcomes, and final outcomes. Let's look first at case detection and enrollment on treatment. Let's see the case detection indicators. The first indicator will be the number of TB patients tested for rifampicin resistance. This indicator will give us information on the accessibility to rifampicin testing. And it will also allow us to calculate the proportion of MDR TB patients among those tested for rifampicin resistance. Next indicator will be the number of MDR TB patients tested for fluoroquinolone resistance. Again, this indicator gives us information on the accessibility to fluoroquinolone resistant testing and allow us to calculate the number and the proportion of pre-XDR TB patients among those tested. Finally, the indicator on pre-XDR TB patients tested for bedaquiline and linezolid resistance will give us information on accessibility to these 2 drugs resistance testing and allow us to calculate the proportion of XDR TB patients among those tested for these drugs. In the figure, in the graph, you can see in blue the number of TB patients. Among those, there will be a proportion that will be tested for rifampicin resistance, or all of them will be tested. We will know how many among them have MDR TB. Among them, part or all will be tested for fluoroquinolone resistance. We will detect the number that have pre-XDR TB. Part of them or all of the patients will be tested for bedaquiline and linezolid resistance, and we will know the number of and the proportion of XDR TB patients among those tested. However, these indicators do not capture information among patients not tested for resistances. So, for example, if we will not know the number of MDR TB patients among those who have not been tested for rifampicin, or the number of pre-XDR among those not tested for fluoroquinolones, or XDR among those not tested for bedaquiline or linezolid resistance. Let's now look at the enrollment indicators. The main indicator on enrollment on treatment is the number of MDR TB patients started on MDR TB treatment. And this allows us to calculate also the proportion of patients started on TB treatment among those diagnosed with MDR TB. Another important indicator is the time between diagnosis and initiation of MDR TB treatment, and the HIV status and ART status among those who have started MDR TB treatment. In this graph, you can see the comparison between detection and enrollment. So the graph shows the cases detected and started on TB treatment in South Africa from 2007 to 2012. And you can see in blue the number of patients that were diagnosed with MDR TB and the number of patients that were started on TB treatment. And in this other figure, you can see also case detection and treatment initiation in 6 countries. Again, diagnosed are in blue and treated are in red. And you can see that in some countries, the 2 lines are far from each other. So meaning that there is a number of patients that are diagnosed but not started on TB treatment. Other countries have the 2 curves much more close to each other, meaning that most of the patients diagnosed with MDR TB are started on MDR TB treatment.